Freddie, thanks so much. A new study from the American College of Cardiology is challenging the way that many people think about heart health and risk. Researchers followed more than 250,000 adults over 2 decades, and they say they found carrying excess fat around the abdomen may be a stronger predictor of cardiovascular disease than body mass index, commonly known as BMI. So here to discuss this with us is Dr. Robert Wozniak. He's a cardiologist with St. David's North Austin Medical Center. Doctor, welcome to our show, and thank you for being with us.
Thank you.
So I want to start with, in what ways does BMI not tell the whole story when it comes to someone's heart health?
Well, thank you for the opportunity to talk. This is a great place for me to impact something that's near and dear, and that's heart disease.
Yeah.
And so what a nice study to help something as simple as measuring your waist circumference and having such a powerful way to predict our future in heart health for men and women. So I would want your audience just to measure their waist. Of women, if their waist is much more than 35 inches, they should see their doctor and talk about ways to reverse that. And in men, that's 40 inches. So the reason that's important is that the BMI used to be something that we would just measure as a calculation when we would get our weight and our height. But this zeroes in and talking about the composition of where the fat is distributed in our body, because the fat distributed in our midsection causes a much more havoc in our body that can predispose to many different heart conditions. We said heart attack and stroke in this study, but there's even atrial fibrillation for those patients who have that. So a simple tape measure can be a very powerful predictor for our health.
Yeah, before someone pulls out that tape measure and measures at home, I mean, what does that measurement exactly tell someone, or a medical professional like yourself?
Well, what we found is the BMI doesn't always accurately predict someone's prognostic, someone's future risk events. So where we would zero in on where the fat is distributed by measuring our waist circumference, that tells us more confidently that there's something that's increasing a person's risk for heart disease. So again, a simple measure can have very powerful impact, and it's something that's reproducible, and we could all do it at home.
Yeah. Are you having those kinds of conversations with your own patients about that particular measurement, and what are you advising them to then do?
I think we all can do a better job in the medical profession. I think we'll start to see more tape measures in the office now. Because having this information is going to be more impactful, and we'll be more confident in giving our recommendations that people are in trouble. Because again, in medicine, the first is identifying you have a problem and then focusing on what you can do to fix that problem.
And I think that it might be best to leave this conversation by talking about some of those prevention techniques. What are some of the things that you advise people to do to lower that risk of heart disease or any kind of issue like that?
Yeah, as I talked about, is identifying you have a problem, talking to your health professional that you have, because it's a long list of things you can do. Some of the stuff we all know, and we like at St. David's, we like to just talk as exercise is medicine, food is medicine. Some of the simplest things can be very impactful for preventing these out of the blue sudden events that really change our life trajectory.
And what's particularly concerning about fat getting concentrated more heavily in the abdomen area compared to other parts of the body?
It is thought that the fat concentrated there causes a dysfunction of your metabolic system, and therefore could affect other things. It certainly is it would predispose you to have problems with blood sugar control, such as diabetes, which is so common in our population. So really getting early identification that I have a problem and then doing something about it could head off other issues that will seriously set someone back from there, in many, many ways.
Well, Dr. Wozniak, we appreciate you coming in and talking more about this. I think this maybe has a lot of people's ears perked up talking about it, so we appreciate you sharing that expertise.
Thank you.
All right.